The FDA is attacking your ability to get individualized medicine. Today, I'm going to share with you the tactics the FDA are using in Big Pharma to attack your individualized medicine to get good medicine for cancer, autoimmune disease, and various other diseases, and how they're making more money off of it.
You're watching the Dr. Jake podcast.
I'm Dr. Jake. I'm an naturopathic medical doctor and integrative physician in the state of Utah. On this channel, I share with you how you can heal your body and eliminate the symptoms of disease without any harmful drugs or surgery. Be sure to subscribe today for more videos like this. I recently filmed a podcast with my co-host, Teresa Marie. In this podcast, we talked about how the FDA is coming after individualized medicine and how this is affecting your health. Make sure to stick around to the end because we're going to talk about how this is affecting how you treat chronic diseases like cancer, autoimmune disease, and more. The FDA and pharmaceutical industries are kind of like this revolving door. So they benefit each other. And also, the employees in these industries are just kind of going back and forth between each other, and they're working together and they financially help each other out. So if you work for a big pharma, many times you're going to get a big position in at the FDA. If you help out the big pharma when you're in the FDA, guess what? You're going to have this lucrative position that's going to be going on in big pharma. So there's this big revolving door going on, making the pharmaceutical industry a lot of money and making us really more sick because they're not really trying to help you get better over your disease. It's all about profits, really. And it's really unfortunate. And this is not something I really knew about when I first started going into medicine and when I first started wanting to be a doctor. But when you actually start practicing medicine and diving into this, you start realizing what's going on.
And so you started your practice in 2014. You were young, you were, hopeful and, maybe naive in some ways when it
Yeah.
came to all
Yeah.
the things that you were going to be able to do with all of the brilliant knowledge that you gained in medical school. And then you started your practice and you started to see right away some of the things behind the curtain. What happened? What was starting to happen in 2014?
So 2014 we'll go back to the real big history of what happened. So Big Pharma has really been going after compounding pharmacies for a while. But what happened is there's this compounding pharmacy that was making epidural medications, the steroid form of epidural medication. And many physicians were injecting this medication into the epidural space, so right into your spinal fluid, and that could circulate throughout into your brain to help with pain and other things. So what happened is this pharmacy, for some reason, wasn't following good sterility practices because a lot of them, the injections that were done had E. coli in it, like
Mm.
14 or more. And these people were getting these meningitis infections through E. coli, which is a huge deal, really big problem from this compounding pharmacy. Now, this was in the news for a while, and there was a lot of hit on this. And really, there was a lot of this big negative light on compounding pharmacies. The FDA took advantage of this. They've been wanting to go after compounding pharmacies forever. Again, them and the big pharma are together. So why would they want to be going after
Okay, but
compounding
before
pharmacies?
we jump into even like why go after it, I'm realizing there's something that we should all probably know. For anybody who's listening in, what is a compounding pharmacy? And
Hmm.
how is that different from like your local Walgreens or, Safeway or something like that type of pharmacy where we typically get our medicine from?
So a big difference between us. So let's say you just go to your Walgreens or Safeway or whatever. They are just giving you medications that are made by big pharmaceutical industries. A compounding pharmacy makes a medication. So they have the formula of a certain pharmaceutical medication. They make it in their lab in that pharmacy, and then they distribute it to you. And they can make it in several different forms. They can make it like in a cream. They can make it in like a troche sublingual thing. They can make it in an IV form. And so they are direct competition to big pharma because they make the drug. They make non-patentable drugs to help patients, and you don't have to rely solely on big pharma. And they make things many times a lot cheaper than the big pharmaceutical industries
Got
do.
it. Okay. So now let's jump into then why would they be attacking these compounding pharmacies then?
Yeah, the big reason why they're coming after him is because they're direct competition to them. So let's say they took out compounding pharmacies, they would be able to just put whatever price they want on a certain drug, patentable or non-patentable drug, and you have no say to it. So a big one with this was in the news a lot, is just epinephrine, a drug that has been around forever. They bought the rights on epinephrine, the pharmaceutical industry did, the EpiPen,
Mhm.
and it was like selling for like 30, $50, and then it went to $600. A compounding pharmacy can make you an injectable form of epinephrine for like 10 to $30. So it's extremely a lot cheaper, and that could be done with all kinds of medications. So let's say that big pharma has what they want and take it out compounding pharmacies. Now they're able to charge whatever they want on medication, and you don't have any of that competitor going after you there. So it gives them a monopoly, really.
How does this affect integrative care then? Like, with some of the things that you wanna do, why can't you just give your patients the patented, pre-labeled, dosage amount of drug that they say is okay versus you going to a compounding pharmacy and getting your medicine through them to help your patients?
So, as being an integrative physician, I really practice individualized medicine, and everyone doesn't need the same form of medication. They don't need the same dosage form. Some people need really low doses, some people need really high doses. And when it comes from just say the big pharmaceutical industry, they're making a ton of a certain medication, they're making just certain dosage forms, and that might not work for someone. Also, someone might need a different delivery form of a certain medication besides it being a pill. They might be able to absorb it better through the skin, or they don't get as much digestive upset, or they have better effect because it doesn't have to be absorbed through the gut and go through the liver, and that changes when that happens. So they're able to do it through the skin, or they're able to do an injection, or they're able to do a sublingual therapy. So the compounding pharmacy are able to make it in the perfect way for just you, and dosage form and the delivery method is just right for you.
Now, I know in your practice, you treat a lot of people with like autoimmune conditions, cancer, and so forth. And with those types of ailments that people suffer from, oftentimes they really do need a higher dose form of medicine or supplements and so forth to be able to really heal their ailments. What relationship have you noticed with the types of the medicines that you've used that have been most effective in treating these types of conditions and how the FDA has gonna come through that back door through the compounding pharmacies and affected your ability to treat these types of conditions?
So first off, I use a lot of IV therapies. So compounding pharmacies are the ones that make many of the substances that I do IV form. Also, want a certain form of a medication, and I don't like whatever everyone else has out there. So I could reach out to a compounding pharmacy and say, "Hey, I want it in this way for my patient demographic or for this specific patient," and they can make that for me. So if you take away compounded pharmacies, I'm not able to do that individualized medicine anymore. I'm not able to do a lot of the IV forms, which when I do it IV, we're able to bypass the gut. A lot of people that come into me have a lot of gut issues. A lot of the chronic illness is related to that. So they're not able to absorb the nutrients very well. So I'm able to do it IV. It's going to be more potent. Also, many of the substances that I do, when you look at the research, we need high dosages of that. And we are able to achieve the high doses of that because we bypass the gut through the IV form. So compounding pharmacies create a lot of my IV therapeutics and help me be much more effective on treating my patients that are dealing with chronic debilitating diseases like cancer, autoimmune disease, chronic fatigue syndrome, or whatever's out there. If they take away the compounding pharmacy, I'm not able to treat them as well because they're taking away a lot of my toolbox when this happens. Also, what happened back in 2014 that we didn't really dive into is they made it more difficult and more expensive for me to do a lot of IV procedures in my office. So what they did is they made pharmacies that were called 503A and 503B. They didn't have that before. Before
Hmm.
you could just order a substance and get a lot of that substance in the office and have that when a patient comes in and use that substance. They changed it that I had to write a prescription for each individual patient that was coming into me for each individual medication. So I order a vial like of 30 milliliters. I only use 2 milliliters of that substance on a patient, and that expires that day. I can't use that on any other patient because it's
Wow.
patient specific. So it's made my industry a lot more expensive and made it a lot more expensive for my patients also when it would have been a lot cheaper. And it's not safer at all to do it that way that I can't reuse that medication in one day. Or and many of these are multi-dose files, so you could use them over 28 days. But let's say I have a patient that's coming in once and I have a 28-day vial, I use that, and then I'm using like 12 different vials in there. It's making that bag so much exponentially more expensive because I used to be able to just use that on a lot of different patients that were coming into the office. So just imagine in any other industry if you could only use, let's say, beef for that specific person and you couldn't use that beef for anyone else. And that's what really happened there. So they were trying to make it much more difficult for us as providers, as physicians, to be able to treat our patients effectively when this happened. Also made it a lot more expensive for the compounding pharmacies, and they had to go through all kinds of different more regulation. A lot of compounding pharmacies shut down because they couldn't spend the money to be able to go through these things. They also made 3B pharmacies, which had a ton of FDA oversight, and they only could compound certain medicines that the FDA say you can make. So you can become a 503A and go through tons of regulation, or you could become 503B and still have tons of regulation, but you have that all up front and you don't have to deal with it all the time. So, but when you do 503B, you don't have to do an individualized prescription. So it makes it easier for us, but we're not able to get every medication we want from the 503B pharmacy. So it just made it extremely more difficult to be a physician and also for the compounding pharmacies. So that was one way they started taking out compounding pharmacies back in 2014.
Now that's the pharmaceutical side. In integrative medicine specifically, you have this beautiful blend of both utilizing the benefits of pharmaceuticals as well as some other more natural means like supplements and so forth
Mhm.
to be able to treat your patients. The pharmaceutical side is how they've come in and attacked individualized medicine. How are they coming in on supplements and other more natural means, off market means in that are affecting people's health?
So in that same way, they have come after supplements because I'm able to make these nutrients in IV form, and compounded pharmacies are the ones that do that. Big pharma only has a few certain nutrients that you do, but they don't have everything I need. So they're affecting herbs and nutrients in IV form, also affecting herbs, nutrients, how they are delivered in a different way. Like a supplement is you usually get that in a capsule form. Compounded pharmacy is able to make that certain herb into a cream, or they're able to make it into a injectable form, or they're able to make it into a sublingual so you're able to absorb it under your tongue. So it makes it very much more individualized for both medications and also alternative substances. And really what I mostly prescribe are alternative substances, and the compounded pharmacy is what I use for that. But so that's a big thing they've gone after in that regard, is regulating that. And they have been going after certain substances also. Like they've taken away certain substances that I use. And what the interesting thing is, the ones that they go after the hardest are the ones that have shown good effect for cancer. Interesting enough. So like IV turmeric or IV artemisinin, which is an extract from wormwood, or IV quercetin. These are all medications that were shown in good research to be beneficial for certain cancer. And what's interesting behind this is IV curcumin and artemisinin, when they were taken off the market, the pharmaceutical industry was going through phase 3 trials on these specific substances that they were patenting. They were putting a certain amino acid on these substances that they were patenting to treat cancers. So it's a pretty interesting thing that was going on. They took out this really cheap medication that we are able to do IV for them, and they increased it by 30 times and made it as a pharmaceutical drug. And you could patent that, and then they have that for 5 years to be able to make a lot of money off of their IV forms there.
So it doesn't seem like that would be just mere coincidence.
Doesn't
It
seem
sounds
like it
like
to
there's
me. No.
obviously a connection there. So what's the narrative? What's what they say, the guys that they eliminate these under while they're patenting their, one amino acid off differented version, pharmaceutical version that they're creating?
So their narrative is they want to make all the money off of all medicine that is out there, and they don't want anyone else to compete with them. So they don't want the supplemental industry, they don't want the compounded pharmacies. They don't want any of them because they're huge competition to them. Because a lot of people like these things that they're getting and they're going after these certain substances. Now let's say
Mhm.
they could take control of all these substances and now they don't exist anymore, or they have total control off of how these substances are prescribed or how they're used, and they use these little ways to make it sound like it's really good and great. We're making it safer for you because we're going to regulate this certain industry. And what they really do is they just take out certain substances when they do that. So really, they just want to make more money, like most business really wants to do, especially big pharma wants to make more and more money off of what they do. And it's really ruining our health because it's making us as physicians that want to really help treat the cause of what's going on much more difficult.
Yes, indeed. And obviously people are not able to get well because they're not having access to some of these IVs. They're having to now take this pharmaceutical version that's not going to be as effective, but makes, the pharmaceutical companies money. And you're obviously seeing that in your practice. Now, thankfully, you have been able to still find ways to be able to treat your patients despite all of the ways that the FDA has attacked the integrative medicine industry, if that's even a word that we could even use.
Yeah. At Integrative Medica, we are still able to help you with integrative strategies for now. For more information on how the FDA is going after integrative medicine, or if you want to learn more about natural or alternative ways to treat your medical condition, click on the video to the right. I'm Dr. Jake, and I'll see you there.